इरेक्शन स्प्रे क्या कुछ नहीं है
कि अगर स्प्रे लगाया तो इरेक्शन होगा, ऐसा कुछ नहीं होता?
ऐसा कुछ नहीं होता
अगर बार बार कोई कंटिन्यूसली सेक्स पिल्स ले रहा है या वाइग्रास ले रहा है तो प्रॉब्लम होती?
Every pharmaceutical drug will have a side effect.
I heard about Kegels.
If you're doing tons and tons of Kegels, then you will get a tight, short pelvic floor muscles and you will then develop pelvic floor dysfunctions.
What are your thoughts on things like Tonga Ali, maca root, Shilajit?
Before you do supplements, realizing that they're not going to work immediately. If you take something that works immediately, it's probably got a PDE5 inhibitor mixed in there. Have you ever heard of shockwave therapy for erectile dysfunction?
So they found that shockwave therapy was not able to create a significant difference.
And it worked okay. It wasn't sustainable. After 6 to 9 months, I could see the level fall off.
Hi, I'm Dr. Ranjith Ramasamy, consultant urologist at Jumeirah American Clinic in Dubai. I specialize in disorders of the male sexual and reproductive system. Today, I'll be explaining to you why common solutions for erectile dysfunction and premature ejaculation fail. Delay sprays and condoms don't really improve your control. They just numb your skin.
Most of these products use local anesthetic agents, commonly lidocaine or benzocaine. These are the same chemicals that are used to numb the skin before minor surgical procedures. When you apply a numbing agent, three things happen. The skin stops feeling touch, it stops sensing pressure, and it stops reading temperature. These sensations are essential because these are the signals your brain uses to decide when to ejaculate. So when you block them, the brain gets incomplete information, timing becomes unstable, and arousal and climax fall out of sync. And when these signals are numb long enough, the body forgets how to respond on its own. That's why men say they don't feel anything. Clinical observations have shown that repeated use of delayed sprays can reduce natural penile sensitivity over time, and prolonged exposure to numbing chemicals may also affect sperm health and fertility. And here's the worst part, that these chemicals don't just affect you. During intimacy, these numbing agents often transfer to your partner, especially with sprays and coated condoms. Your partner experiences either discomfort or irritation, reduced sensation, and a growing distance she doesn't really know how to talk about. When these sprays stop working, most men take the obvious next step. They go to a doctor, and that's where you get prescribed medicines that you were never meant to take. Most men don't even realize what they're taking. Google it right now. Look up paroxetine, SSRIs. You'll see it. These are antidepressants. They were designed to treat clinical depression, not sexual performance, not control, not erections. So you might ask, why are antidepressants being prescribed for premature ejaculation? And why do some men feel like they're actually working? To understand that, you need to understand what is serotonin. Serotonin is a brain chemical that acts like a brake pedal for your nervous system. It calms the signals, slows your reactions, and reduces urgency. In depression, where the brain is overactive or unstable, that brake is necessary. SSRIs increase your serotonin levels by preventing its reabsorption in the brain. In simple terms,
They lock the brake pedal to the floor.
now here's what happens. When serotonin goes up, your brain signals slow down, spinal reflexes slow down, and the sensory urgency drops. So the reflex triggers ejaculation also slows. That's why you feel like you're lasting longer. But understand what actually changed. You didn't really treat the root cause, you just lowered sensitivity across your entire system. And serotonin doesn't affect only ejaculation, it also regulates your sexual desire, arousal intensity, erection quality, and emotional engagement. So when your serotonin is artificially pushed high, your libido or sexual desire drops, arousal feels flat, erections weaken, and bodily sensation feels dull. Now here's the most dangerous part. When you stop taking SSRIs, the brake is suddenly released, and that slowing disappears, and your body goes back to the same pattern, often faster than before. Hence, your nervous system rebounds. That's why many men say it got worse after I stopped taking these meds, because nothing was really repaired or retained in the first place. See, These medicines do have a role, that is, of treating clinical depression, but they were never built to restore sexual control or erection quality. They don't teach the body how to function, they just slow it down. And a slowed system always fails the moment you remove the sedated support. Almost every man I meet has tried pills like tadalafil or sildenafil at least once. A friend suggested it, a doctor prescribed it, or you just wanted to see if it helps. And for that moment, yes, it works, but it's important to understand why. An erection happens through signals, not effort. When you are aroused, the brain releases a chemical called nitric oxide, which tells your blood vessels to relax so blood flow can increase to the penis. Now here's the key part that most men are never told.
Your body also has a stop system, an enzyme called PDE5 that breaks down the signal so the blood can eventually drain. And pills like sildenafil and tadalafil work by blocking these enzymes called PDE5. So blood vessels stay open longer than they should, even if the original signal from the brain is weak. And when you force the door open again and again, your body adapts. Your brain learns it doesn't need to send a strong signal anymore because the pill is doing heavy lifting.
And that's how physiological dependency forms. That's why men tell us, earlier the 5 milligram pill worked, then I needed 10, and then 20, and then now nothing works. This isn't recovery, this is just tolerance. And because these chemicals relax the blood vessels throughout your entire body, not just one area, you pay the price with headaches, flushing, and heart palpitations. Wait, there is more. For men with hidden heart or blood pressure issues, this can be dangerous. That's why these pills come with strict medical warnings on the FDA label. Erectile dysfunction is an early warning sign of vascular disease. Cardiology and sexual medicine guidelines treat ED as a circulation red flag. If you need a pill to perform, you're not in control. The pill is, and the day it stops working, you're left with the same problem, but now it's buried much deeper. But why is it that a man can spend 6 months in the gym and still fail in the bedroom? Exercise is good. That's not the issue. The issue is what kind of exercise and why. Most men start walking in the morning. They join a gym, they run, they lift, they sweat, and yet the problem isn't solved. Here's why. Most men don't actually train for function. They train for aesthetics. Chest, arms, abs, or just general fitness. Running and gym workouts mainly improve heart health, large muscle strength, and stamina and endurance. All good things, but sexual function doesn't run on these systems. Erections and control depend on pelvic muscle coordination, nerve timing, blood flow regulation, and nitric oxide signaling. And random workouts don't really train any of these systems. So what happens? You feel better, you look better, your energy improves, but the sexual response remains flat and doesn't change because the system that's failing is still left untrained. And this shows up beyond sex too. As men age, many of them struggle with basic functions like bladder control, not because they're weak, but because they never trained their pelvic floor system. So they keep putting in the effort, but the effort isn't really treating the real problem. See, exercise can help, but only when it's specific. Otherwise, you're just working hard in the wrong direction.
That's where the problem starts.
The pelvic floor isn't just one muscle. It's a complex group, mainly the levator ani, the bulbocavernosus, and the ischiocavernosus.
These are designed to contract and relax in rhythm. They're not meant to stay clenched all the time. Research shows that both tightness and weakness in these muscles can cause erection problems and early ejaculation. The problem isn't lack of strength, it's an imbalance.
And there are different problems you can have here. First, in many men today, the pelvic floor is hypertonic, meaning overtight because of long sitting hours, chronic stress, shallow breathing, and constant clenching. So when you have a tight pelvic floor and squeeze it even more with Kegels, your blood flow gets restricted, The pudendal nerve, the nerve that controls sensation inside your penis, gets irritated and the pressure builds up too quickly. That's when men notice pain or discomfort during, after urination, tightness or heaviness at the base of the penis, and ejaculation that gets triggered too early. So in this case, doing Kegels doesn't really help. It actually worsens the exact thing causing the problem. Studies on hypertonic pelvic floor dysfunction actually show that excessive tightening can worsen ejaculation and erectile stability, not improve it. Second, in other men, the issue isn't tightness. They have weak or poorly coordinated pelvic floor. But even then, doing random Kegels doesn't really fix it, because when a muscle is weak, it doesn't activate instantly or fully. So when you try to squeeze, your body cheats. Instead of the pelvic floor, you start clenching your abs, your glutes, or your inner thighs, because they are stronger and easier to use. So you feel the effort, but the pelvic floor itself never learns to switch on at the right time, hold the pressure properly, and relax when needed. That's why Kegels fail. They don't really teach breathing, they don't control pressure, and they don't train timing. And erection and control depend on timing, not squeezing harder. So men keep exercising, nothing improves. Some men even report groin heaviness, faster climax, fatigue in the area, and no real change in erection quality. Not because Kegels are bad, but because they are being done blindly. Pelvic floor research is very clear on this. Assessment always comes before strengthening. You first need to know what state your pelvic floor is in. Tight, weak, poorly coordinated. Only then it can be fixed correctly. This isn't guesswork, and definitely not something a YouTube video can diagnose. Training the wrong pelvic muscle is like fixing the wrong wire. You don't get results, you just create new problems.
Let's first try to understand why men trust herbs like Shilajit and Ashwagandha. See, Ashwagandha is known to reduce stress, and Shilajit is known to improve energy and strength. And it's natural, so what's the harm? So men eventually think if stress is lower and energy is higher, sexual performance would be better. That's where you're wrong. See, Ashwagandha works by influencing cortisol, your body's stress hormone. If cortisol is abnormally high, Ashwagandha can help bring it down slightly. That may make you feel calmer, even sleep a little bit better. But cortisol is not the cause of erections or ejaculation control. And cortisol is not meant to be low all the time. It's actually very essential for your daily bodily function. Shilajit, on the other hand, works differently. Its primary role comes from fulvic acid, which helps with mineral absorption. So if you have a mineral deficiency, your energy levels may improve slightly with Shilajit. But mineral absorption or reducing cortisol does not teach the brain how to send signals. It does not increase nitric oxide release, and it does not fix timing or control. That's why some men may feel a short-term boost, better mood, slightly more energy, but the core sexual problem does not improve. Men keep taking these herbs for months because nothing is getting worse, but nothing is actually getting better either. There's one more thing you need to know. Many powders sold online or by roadside babas are not regulated. Studies have found heavy metals like lead and mercury are present in some Ayurvedic preparations, especially the untested mixes. That's why some men experience digestion issues, acidity, constipation, numbness, or discomfort. Not because Ayurveda is ineffective, but because random, unverified products are just unsafe. Using herbs for basic well-being, if you want, but don't really expect them to reverse your erectile dysfunction or premature ejaculation. Let me explain what PRP and shockwave really means. PRP stands for platelet-rich plasma. It involves getting growth factors from your own blood and injecting it inside the penile tissue. And shockwave therapy uses sound waves to stimulate new blood vessel growth. These treatments were designed for men with actual tissue damage, post-surgery trauma, or severe vascular disease. Most men taking them don't even fall into that category. In most cases, the tissue is healthy, The problem is just lack of blood regulation. Erections don't fail because men lack blood vessels. They fail because existing vessels don't really respond well to proper arousal. And no, PRP cannot retrain that. Shockwaves can't retrain that. That's why, even if any improvement happens, it's inconsistent or temporary. One more thing men should know. Shockwave therapy for ED is not FDA approved as a standard treatment. That doesn't mean it's unsafe. It just means it hasn't shown consistent, reliable results for most men, which is why outcomes vary so widely, because the solution didn't really match the problem. And all these quick random fixes that we discussed are rarely tried alone. Men start stacking them. They try multiple things at once. A pill for erection, an SSRI to make the erection last longer, Ayurvedic herbs to support your sexual function, L-arginine to improve blood flow, gym and Kegels on the side. So now multiple systems in the body are being pushed, slowed, blocked, or forced all at the same time. That's why one day something works, another day nothing does, because the body isn't confused. It's just being pulled in different directions. And once your body adapts this way, single fixes like pills or random exercises stop working. Because you aren't dealing with one broken part, you're dealing with a broken circuit. To fix it, you just can't patch one wire. You have to restart and rewire the entire system.